What's up, everybody? Welcome to this week's episode of the Well Man's Podcast. My name is Bryan Brosey. I'm joined by my friend and co-host, Dr. Keoni Tita. Keoni, how are you today?
I'm doing good. Thanks. Hi, everybody. I'm kind of excited and a little bit, I feel like I'm a little bit out of my league, and I know Bryan does too, about talking about this topic, but I do feel like we do need to talk about it because I see it quite a bit, and that's interstitial cystitis. And I see it a lot, primarily as pain management using acupuncture. But
So what is it, Keoni? Because I told you when you texted me the topic that if I had no medical terminology knowledge, I wouldn't be able to put the pieces together on what this means. So what does interstitial, say it again, cystitis.
Cystitis, yeah. So anytime you say cystic or cyst or anything like that, and you put an itis on the end, it's usually referring to the bladder. Okay, so cystitis, itis at the end of it is inflammation. You can think about just an angry bladder, and it actually happens to be within the interstitial, the wall of the bladder where they think the issue is coming from. And it's a chronic condition that basically causes pain and pressure, sometimes not only in the bladder area, but throughout the whole pelvic region. And it can range from just mild discomfort to severe pain, and then just this constant frequency of feeling the urge to have to go to the bathroom from this pain and pressure. And, when you go to the bathroom, you void very little many times, but yet you feel like this constant, like for some of my patients who have been referred to me, sometimes it's like every 5 minutes they feel like they need to run to the bathroom.
You're getting the urge, but there's not the volume behind it.
There's usually not the volume behind it. And it's kind of, an mysterious disorder. I mean, we really don't know what the cause of it is, and it's predominantly found in women primarily, but it also can be found in men. And with men, unfortunately, they just write off men that have this. Usually takes a long time. It takes a long time for women to get a good diagnosis on it too, but for men, they just usually write it off as like prostatitis before they even think about interstitial cystitis. And there's many things that can cause, this bladder pressure, pain, pelvic pain. We talked about this in our, when we were talking about UTIs. UTIs will mimic this, right? So you want to rule out urinary tract infections. So you want to make sure that there's not a infectious agent like a bacteria that's causing this.
Right.
And there's a lot of different theories of what's actually going on here. So it may be an infectious agent. It could be maybe the nervous system is discombobulated, so you think you have to go when you really don't have to go. So it's like a whole, it brings into a whole neurological, brain, spinal cord, the nerves going to the bladder type, not getting the effective messages there. It can be in an immunological condition, maybe autoimmune. Some of the drugs that treat it are actually antihistamine drugs. And so it can be histamines that are irritating the bladder. It can also be maybe the bladder's not sitting right in the pelvis. Maybe there's prolapse. Maybe that's what's causing it. By the way, we actually talked about this on episodes 97 and 158 with Dr. Farheen Patan and Dr. Sarah Joy Cundiff, right? Respectively. And they talked a little bit about this with pelvic floor dysfunction. I wanted to bring that up because most conventional docs with people like this won't even think about referring to a doctor of physical therapy for this, and a doctor of physical therapy that actually specializes in pelvic floor dysfunction. As we found out on those podcasts, they're kind of hard to find, and it's specialized.
It's like getting a
expertise.
Unicorn.
You're right. So we were lucky enough to have them on. So those are episodes 97 and 158. and Dr. Patan is a local person that I refer a lot of my patients to that have IC. It's just part of the treatment that I will suggest to my patients that have this.
Absolutely. Now, do we rule it out, Keoni, to, is it a diagnosis by ruling out other things, or are there ways that we can?
It's typically a diagnosis of exclusion for the most part. There are some things that kind of can, suggest it more so than other things, but yeah, it's typically a diagnosis of exclusion. Like you want to rule out an infection.
Right. Another reason why it's going to be so tricky to get to the bottom of this, especially navigating kind of the healthcare system, like you alluded to.
Right. You also want to make sure that, it's not an allergic component. Like a lot of people, there's something called the IC diet out there. So a lot of people can get relief by just eating certain foods and avoiding others. There's actually, if you go online, there's something called the IC diet, and some people can get relief from that. It's really hit or miss with that. So my patients, some people, it may help, but it's certainly not one of these, at least for the patients that I've seen, where it's like it cures the disease or anything like that.
And now off the top, what is the diet? Is it low acidity? Is it,
yeah,
low
pretty
carb,
much.
Blah, blah,
Yeah,
blah?
you hit the nail on the head with that. It's typically a low, kind of a low acid diet. For example, it's pretty well known in the literature that people who take vitamin C, ascorbic acid, can irritate their symptoms. So that's one thing I do with treatment is we just take people off vitamin C or their multivitamins that have that.
Okay.
So yeah, it tends to be a low acid diet, but that's not 100% foolproof, right? So,
Right.
So a lot of times, it's just, it could be just a strange food that seems to exacerbate the symptoms.
Mm-hmm.
But also, from a conventional standpoint, one of the ways that they actually help diagnosis, and it's not really a great way to do this, but they'll actually will fill the bladder with what's known as a bladder irritant. I think it's like potassium chloride, I think. And if you get pain or pressure with that, as opposed to water as the kind of the placebo, it can kind of point you to the direction that you're dealing with IC. But
and is that typically more acidic, like the potassium chloride? I'm forgetting.
It's just a bladder. Yeah, I guess it's just a bladder irritant. And one of the things about this is on the wall of the bladder. I mean, when you actually go in there and they do a cystoscopy where they actually go in there and look at the bladder, you may see irritation on the bladder wall. And for some people who have it bad, you may even have ulcerations. I think they call them hunter's ulcers, but you may actually see ulcerations on the bladder wall. And just think about how miserable that is, having a raw bladder inside.
Yeah, even the day of testing doesn't sound fun. We're gonna pump you full of bladder irritant.
It's a good point, because I've had patients who have actually gone in and had the testing for the bladder, or had their bladder filled to, test voiding and all this stuff. And they actually came out worse from it, just because it just made the bladder very angry. So there are ways to help, with the pain. Like you can actually do, there are actually conventional treatments that can help just take the edge off. And when things get really bad, they may use something called alkalized lidocaine, where they actually put it into the bladder, where it will just help quell the pain.
Okay.
So anyway, it is a diagnosis of exclusion, as you kind of brought up there. There are a number of treatments for it. There seems to be a histamine component. So there are some drugs out there called antihistamines that seem to help. Some antidepressants that have antihistamine activity will help. Sometimes you can use medications like DMSO injected into the bladder that can help. There's actually behavioral therapy training. There's actually manipulation therapy, like our pelvic floor physical therapists may do. One of the things that I found out to my chagrin is I've actually, in the beginning of my career, actually had my people with this bladder floor dysfunction that was really IC, had them kind of look into doing Kegel exercises, and 50% of the time it just exacerbated the situation. So again, I like to refer that type of stuff to a doctor of PT who is an expertise in it, just so they know when that can be helpful.
Yeah.
I've actually, one of the things I do in my clinic, I do use acupuncture, and one of the things that may help, just because it just seems to be nervous system dysregulation. Sometimes a TENS unit over the bladder on the abdomen may help. I'll actually use needles and do electrostim, so you get further electrical nerve stimulation, which actually is closer to the bladder because you're using needles. So I'll use that with acupuncture. That seems to help. I'll do a lot of the acupuncture bladder points, which tend to be more around the ankle area, as long and on the lower abdomen. That certainly can help, but it's just one part of the treatment.
Right.
I've had in my career probably one or two people out of probably 10 to 20 people who really just got significant help from acupuncture alone.
Now, do people tend to clear this up with you, Keoni, or is it a management thing?
They do over time. Some of it is management, though. Some of it is management. A lot of people with interstitial cystitis will, over time, according to literature, get better with very little treatment. But on a lot of, and that's with just really mild cases. But some people, it's the pain is severe. The discomfort is severe. They feel like they can't even leave their houses because they have to, pee every 5 minutes. I even had some patients where I'm just like, well, that you have to avoid. You're probably not going to avoid a lot until we get it under control. Wear like a diaper or something that can soak it, so you're not constantly struggling against the bladder that's trying to void, where it's painful. So a lot of times maybe that can help the signal, where you're actually not fighting the signal. You're just saying, okay, I'm going to relax and just void no matter where I am. And, it may help. And sometimes that takes away the angst, because anxiety can bring it on too. Right. So if you are out somewhere, like I had a patient the other day who got stuck in traffic and was like feeling like they had to void, and I was just like, when those times can come, you don't know when they're going to come. It may, until you get this under control, wear like a pad or something absorbent that can just, if you have to pee or void, just do it.
Yeah.
And a lot of times they don't, they don't have to do it.
You can definitely see how that would help.
Very little. Yeah.
I might start doing it and just feel like a king everywhere. You might be talking to me right now on this podcast.
just don't care. Yeah, exactly. But it's really awful, because the other thing that can happen, Brian, is, it's just not bladder, pain or with voiding, right? I mean, usually it comes with, frequent urination all night, so you're not sleeping.
Right.
Chronic pelvic pain, pain during sexual intercourse. I can't tell you how many people that I've had where this actually has a negative effect on their relationship with their significant other. Because of it, because, feeling like this, you certainly are not going to be in the mood at all, ever, until it gets under control. Some of these people seriously have to feel like they have to void up to 60 to 80 times a day.
Whew, man.
Yeah. It's pretty bad.
Now, with the patients you've seen, Keoni, is this something that typically, like using that example of someone who feels like they have to void 60 to 80 times a day, is that something that they're consistently dealing with over the course of this? Or is it, on Wednesday I felt that way, and then, maybe Sunday I felt that way? Does it come and
Well,
go? Does it stay pretty consistently? How can people pick up on this might be it?
If you don't do any of the stuff that we talk about here, you know, for the most part, it can be pretty persistent and consistent. You know, there does seem to be a waxing and waning of symptoms somewhat, but there's no rhyme or reason to it. When I talk to my patients and when I look at the literature on, there's no rhyme or reason why it's, you know, waxing and waning. Like, what are they doing? Like there's some, like maybe it's the food, you know, food that they've eaten or something. Maybe they're not under as much
frustrating.
Yeah. Oh, it is, to the point where people just don't, you know, are severely depressed and can't live like that. I mean, you know, or like, I can't do this anymore. There seems to be a genetic component to it also. For both men and women. So that may be something to look into, or to maybe, if there is a genetic component or you're getting mild symptoms, to be on top of it. You know, basically we have an angry bladder wall. You can think about it that way. So we just really want to minimize any bladder irritants that can happen in there. And so that gives us an idea of how to treat it also. So from a conventional standpoint, there are some meds that can actually kind of coat the bladder wall and help soothe it. From a naturopathic perspective, there are also some meds that can also do that, that you can take orally. But from a conventional standpoint, a lot of times you're putting these meds right into the bladder. You know, when it gets really bad, Brian, I mean, where people can't even deal with it, one of the treatment options is remove the bladder, right? And so, yeah, remove the bladder, and then they create like a little stoma in your abdomen, a little opening where they take part of your intestine and create like a ureter, and then you have a bag on you that just collects the urine. I mean, some people have actually gone that way because it's gotten so bad. And that is absolutely the last resort, from a conventional perspective. But think about when it's that bad and you kind of contemplating that route, you know?
Right. Yeah, absolutely.
So, the interesting thing about this, one of the diagnoses of exclusion is, you know, if you have symptoms like this before the age of 18, you're just not going to get this diagnosis. Most of this happens with women over 30 years of age. It's really also interesting that fair skin and people with lighter hair, red hair, seem to have a greater risk of IC for some reason. That may speak to a genetic component there.
Where the angry redhead saying for angry bladder.
The fire in the bladder, right? You want to rule out prolapse. You know, one of my cases, this is really interesting. So one of my cases with IC was, we were treating it nonstop for years, and the acupuncture actually gave them some relief. What we found out is that they had some type of abdominal surgery many years before. When they went back in, they did image, and they actually found a staple in the bladder wall.
Holy shit.
Oh yeah. So this person was miserable for a decade or more. They removed the staple, problem solved, which was irritating the bladder. So yeah. So it could be, sometimes it's as simple as that. Also, a lot, you know, people with endometriosis, which can also mimic this, you know, seem to be at higher risk for it. And people with endometriosis can have endometriosis and have this, and then it's like, which one's causing which, or are they just potentiating each other to just make you more miserable? You know, and those are two different ways. You know, you have to approach both of those things differently as far as treatment goes.
Right. Yeah.
So you want to kind of try to deduce what's actually going on there.
How did you find out about the staple, Keoni?
Well, just
for imaging of something else.
Just from the history and trying everything, you know. Just asking the patient, have you had abdominal surgery before? Yada yada yada. We've tried everything. You're still miserable. Go back in for imaging, and lo and behold, there's a staple in her bladder wall. you know.
Oh,
So
man.
so yeah,
TSA
I
does a
mean,
really bad job too then.
right.
It didn't show up.
Right. So anyway, just to go over, like, the conventional diagnosis is you get a medical history, a lot of times I'll have you do a bladder diary. Pelvic exam is usually done. They're examining your external genitals, the cervix, the abdomen, all this, your number of urine tests, basically to check for signs of a urinary tract infection. By the way, most of the people with IC we don't see any bugs with IC, but they still think there may be a bug there, kind of like H. pylori, which can exacerbate, like, or seems to be related to increasing your risk of, like, gastritis and gastric cancers and stuff. Some people just have it as part of their normal flora. Well, there may be a bug there that may, like H. pylori, that is yet unknown, but some people think it's highly possible that we just don't know yet, that's causing a problem that you can't pick up on a urine test. We talked about cystoscopy. This is where the doctor inserts a tube into your bladder and just looks, usually measures bladder capacity. Can use, like, lidocaine to help make you more comfortable. And you can use that as treatment. Sometimes biopsy can go there, can help with that. We talked about the potassium sensitivity test, right? Putting the potassium in there to see if it makes people more miserable. If it does, then we can pretty much get an idea that it's IC. It's not 100% by any stretch of the imagination. Treatment from a conventional point of view, if you're lucky, and I do say this, really, if you're lucky, because most doctors, it's not, and this, being a doctor, a PT, most doctors don't automatically refer to a physical therapist for this. And you kind of have to know which ones actually specialize in this. But treatment from a conventional standpoint, part of it would be physical therapy, should be physical therapy. And then the medications, just to go down the list, anti-inflammatory drugs, so ibuprofen, Advil, Motrin, those types of things over the counter, can help in some, relieve pain. Antidepressants, like amitriptyline, can help relax your bladder and block the pain. Some of these also have histamine activity. Antihistamine medications like Claritin, even some of these medications that are known to be used as acid blockers for GERD and reflux may help. There's a medication out there called Elmeron or Pentasan, polysulfate sodium. And this one is an approved treatment specifically for this. They're not really sure how it works, but basically what it seems to do is just help restore help coat the inner surface of the bladder and protect it from, irritants. And then there's, the TENS unit that you can do at home. I will do stimulation with acupuncture, both on the bladder, at the ankles, using electrostim, and also sacral nerve stimulation. So when I do acupuncture, I'm actually using the nerve pathways that actually help innervate the bladder and stimulating those, and that can really help.
Yeah. And correct me if I'm wrong, Keoni, or let me know what you're thinking here. But as far as just being PT and what I know, there's two ways to kind of use that e-stim, like you're mentioning. And it seems like here, what you're really doing is the kind of gate the pain theory, where I use this as an explanation to people, where you're at a concert and the concert is so loud, that's your pain. We turn up another concert, and slowly we die out the pain concert, and we're only hearing the other concert. And that's a little bit of what this stim is doing.
Yeah, no, I think that's exactly right. That's exactly right. And what I hope for with that, it actually like a reset, right?
Right.
So that you basically start ignoring those pain signals.
Right. So when you turn
while.
off the other concert, everything's kind of settled down.
Right. And I think that plays a role, but but I rarely have seen it just due solely to that nervous system dysregulation, right? Because think about it, if your bladder wall is irritated, eventually that irritation is going to override signals anyway. So it's like you really have to treat this from a multifactorial perspective, right? A number of treatments to soothe the bladder wall, maybe help with, do electrostim, maybe some of the conventional treatments, and then also do a lot of the natural treatments that I think really can help turn that whole system around and just help cure people. So let's talk about some of that stuff. So we talked about avoiding vitamin C, sometimes more acidic foods. There is an IC diet out there. I recommend people go look at that. If we're talking about acidic foods, sometimes alkalinizing foods, but also alkalinizing treatments can help, right? So one of those things would be like baking soda, right? The cure-all. Baking soda, you have to be careful with it because you have to know how to take it. You don't want to take too much because it can cause problems. But sometimes bicarbonate baking soda can help soothe an IC flare within 30 minutes. So sometimes I'll recommend that to people. There's actually something over the counter called Preleaf, which is calcium glycerophosphate. You can buy that over the counter, and that compound can actually help soothe the bladder also.
And these all are more basic compounds, or attempts to alkalinize your body, or your ABGs, your blood gas.
Right. And so what is another one? Magnesium. There's some indication magnesium may help too. Okay, so I'll recommend that for people. Probably the main herb or Western herb in the Western pharmacopoeia that we use mostly, we think about aloe vera. So aloe vera caps can really help quite a bit too, to control symptoms. Prebiotics, probiotics, omega fatty acids, a lot of these can act as an inflammatory component, but I've never seen these, and I'm waiting to see them, where people take them and the next day I get a call and be like, yep, that worked. I mean, it's these things are like, it seems to take some time for people to, kind of get over it a little bit. Vitamin D also seems to help. There's research that suggests low levels of vitamin D weaken the pelvic floor, and which can lead to chronic pain. There also seems to be a anti-pain component to sufficient vitamin D levels. So there's some research that shows that can help. I also look at medications, like some of my patients who are suffering from constipation with pelvic floor dysfunction certainly does not soothe anything. It can make things a lot worse. So iron supplements, sometimes they're known to be constipating, can really be a problem there. So I may look at that and see if we can find or use iron supplements that don't do that as much. Like there's iron bisglycinate, which doesn't really do that as much. There are, antioxidants out there, with the exception of vitamin C, that can certainly help. I'll just briefly talk about some of the IC friendly foods, but you can find these on a diet, and this is not 100% written in stone, but we talk about prebiotics. The prebiotic foods tend to be like asparagus, dandelion greens, artichokes, Jerusalem artichokes, leeks, oats, onions. These things can help. By the way, onions are full of quercetin. Quercetin is a compound that I use for it. Quercetin is an antihistamine, natural compound that, along with nettles, I may use. So you see this in a lot of like bladder formulas for IC, natural formulas. You'll definitely see quercetin in there with it. A lot of fermented foods that have probiotics in them, like yogurt, miso, can help. Our antioxidant foods. Sometimes these foods have vitamin C in there, but usually it's a supplemental vitamin C that seems to be the most problematic. So unless you just know eating blueberries may help and have a nice effect on it. But typically I don't see too much of an aggravation from eating certain fruits that have vitamin C in there. Pears, plums, watermelon, apples, those things can help. All the omega-3 foods that have, the ALA, the other like plant-based omega-3 foods are going to be like nuts and spinach and beans and things like that. Those things can also help. But when we talk about bladder irritants, as far as, and there's some research that says this can help, is sometimes I'll just supplement my patients with glucose aminoglycans. They're called GAGs for short. The thought here being that if you take these orally, it will help supplement the mucosa of the bladder wall and help prevent the irritants from going there. This is not something that's going to have a wow factor overnight. You're going to have to be on it a long time. There's no real good research on it, but we do know something is going on with the bladder wall there where the integrity is not intact.
Right.
What else?
Just in kind of looking through some information, Keoni, for physical therapists specifically, they mention paradoxical breathing helping when the patient is in pain. Now, not something I've seen, but just something, that I've dealt with or treated directly. But something that I saw in reading about it was just, so when you breathe, your diaphragm should expand down, and in theory, you would be compressing the bladder, right? Everything would be getting a little bit more compressed in the abdomen. And they're saying
when you inhale, right?
And they're saying when you are in pain or suffering from this, to switch that and chest breathe a little bit more, which just off the top makes sense in terms of putting less stress on the bladder, just kind of keeping it a little bit more stable and stationary. Not a habit you'd want to develop, because we don't want to breathe that way long term. It's definitely not going to be healthy for us. But if we're, as you're going down the well plan and kind of getting better from this, if you have a bout of pretty severe discomfort at the time, you could try that.
Yeah, that's interesting. Wow. Okay. Yeah, and that's one of the things, because off the top of my head, I would have been like thinking, well, maybe if you belly breathe, where you're actually using your diaphragm, especially if that bladder is not sitting appropriately in your lower abdomen, right, that it may help. But also the paradoxical breathing
of giving it more space.
Giving it more space to kind of definitely keep you in less pain. What else? So some of the other natural stuff I just wanted to go over, because I think people are kind of really like banging their head against the wall with things that can help. And I don't like throwing a lot of pills at people, but sometimes it's just like with this, it's like, well, this seems to have some research on it, so why don't you try this? It's certainly not going to hurt. One of the things that may help, there's some research on it, is melatonin. It seems to hold some promise in treatment for IC. We talked about quercetin being a natural antihistamine. Other natural antihistamines are like nettles, but a herb called butterbur may also help. Pumpkin seed oil for IC. So you'll see pumpkin seed capsules that may help. Corn silk. There's corn silk is kind of a mucilaginous substance that you can take. Usually I see in tincture form that will help soothe the bladder also, just like kind of the aloe vera will. So a lot of times with bladder formulas, you'll see aloe vera and corn silk kind of combined together. Bioflavonoids, this is why probably some of the fruits, even though they're high in vitamin C, seem to help. Anything that can supplement glucose aminoglycans like glucosamine, sulfate, hyaluronic acid, chondroitin, all those things may help. Sometimes you'll see these formulas combined with herbal antibiotics, like berberine or Oregon grapefruit extract, or an herb that has berberine in there, because sometimes there may be a bug we don't even know about in there that can help. There's another compound that it kind of overlaps with urinary tract infections that I use, called D-mannose. It just inhibits irritants from attaching to the urinary tract or possibly to the bladder wall. This is a supplement you can use. And then there's another one called PEA, or palmitoylethylamine, and that is found in like lecithin. I think it's even found in chocolate. I think we talked about it on our cocoa episode, that it's even found there, and that also seems to have some effect, at least in animal models, where it can help alleviate the cystitis. There's some research articles on some Chinese herbs also. Usually I have to match the formula to the symptoms. So for a lot of my patients, I will use Chinese herbal formulas, and sometimes I have some pretty good luck with these formulas. So this is just something for people to think about that are suffering from IC. There are some Chinese herbal formulas. You will definitely want to talk to somebody who is, well informed about that. Usually a medically trained acupuncturist that has actually gone to traditional Chinese medical school, like myself, and has done the 3 or 4 years of that instead of somebody taking a 2-week course, will know some of these formulas that will help. There are more Western herbs out there that can certainly help also, and they're usually combined in formulas. One of them is Angelica leaf extract. I've seen bladder formulas with that herb alone. Sometimes it's combined there. And then, there are homeopathics that can be specific for basically the symptoms of IC. I'm certainly no expert in homeopathy, but I certainly use them at the very least. And I'm not,
We'll talk about this long and hard, you and I.
yeah. I mean, whatever works, right? Like, I'm all about the placebo effect. I don't understand homeopathy. I am, as far as a Western practitioner, I have more training in it than most, just because in medical school that I went to, we had elective courses on it. So I took it, but I will use it. And I've had one patient in the past who, who knows what helped, because I threw a ton of it out there. But there's compound homeopathic medications like creosotum or sarsaparilla or chimaphila. These are homeopathic remedies that may help also. Some of the main things you'll see if you go to like the Mayo Clinic websites or the IC websites, they talk about, of course, diet modification when they're talking about like integrative treatments. They're talking about staying well hydrated, heat therapy. Some people really just feel good with a heating pad on their lower abdomen. It just really seems to help them. There's some other thing over the counters that I don't know if you've heard of those azo bladder relief tablets. Like they help relieve mild pain. Like if somebody's having like a urinary tract or just having bladder pain or whatever, sometimes they can take that and they will help them so they can, until they can get help or figure out what's going on. That can certainly help. All kinds of bladder supplements out there that can help. Meditation, muscle relaxation guided imagery. There's, the bladder training. This goes back to, talking to your PT, know what your triggers are, and that type of thing. But I think the main thing, one of the first things is, and this speaks to this woman who had the staple in the wall of her bladder, right? Is to really think about all the rule outs that are there, right? I mean,
right.
I see patients can mimic IBS. They can mimic people with endometriosis, vaginal pain, certain STDs and all that. So you really want to make sure you're ruling that all out. So like you said at the beginning, it's kind of like this diagnosis of exclusion when you really come down to it. There are lots of options out there that can certainly help. Unfortunately, when you see a disorder with lots of options and stuff out there, it usually indicates that we don't know what the hell is going on with that, so we're just throwing stuff at it. We have a little bit of research on it. I do know that IC, at least in my experience, is much, much better treated when you're using a combination approach. Again, I see that throughout with almost all disorders we talk about. And when I say combination approach, I'm talking about combination approach with conventional treatments as well as unconventional treatments, but also combination approach with some evidence-based unconventional treatments that I will use. So acupuncture, supplements, that type of thing can help.
No,
So,
Keoni, I know every patient that you see kind of gets a well plan. And we obviously we went through a huge list of things that could be on that well plan. But just give us like 1, 2, 3 of kind of the order of operations. So it seems like, someone's has not had the result that they would want from conventional treatment. Seems like they would address the diet, try and figure out what the irritants are, but just kind of fill me in on like a quick 1, 2, 3 of what that well plan would
right.
look
So
like.
1, 2, 3, and this is kind of the rule of thumb that we talk about on our podcast, right? We kind of have a therapeutic order. We start with the lifestyle interventions first, right?
Yep.
We did all our rule outs. So we were pretty sure we have an IC diagnosis. So then we talk about diet modification. We want to make sure that diet is not irritating the bladder. We talk about being very well hydrated. So the lifestyle stuff there, even to the point of some of these people that I see, we want to even talk about like helping them get to sleep, right? Because a lot of them aren't sleeping. We know that if you can sleep, you're going to just feel better, and heal better. So that's the main thing there. So, and then the number 2 from that, for at least from a naturopathic perspective. Now, on top of this, people are usually doing conventional treatments, right?
Right.
But my 1, 2, 3 is lifestyle modification, diet modification, that kind of fall under number 1. Number 2 would be nutraceuticals that kind of can help soothe the bladder wall. One of the main herb used for that is going to be aloe, the aloe caps. There's many out there. And then we go to some of the more invasive approaches that I use, which is going to be like acupuncture or physical therapy. All my IC patients get referred to a physical therapist now, every single one of them. Just because I've had patients where it was just some weird, like the bladder was just sitting weird in the pelvic girdle. I don't know what it was, but whatever the PT did, that seemed to be the trick. So I just always refer them there just to do that. That's it pretty much.
Yeah.
Lifestyle modification, or nutraceutical supplements, and then the more invasive stuff where you're actually using medical intervention, where a PT is actually having hands-on manipulation, and then where as an acupuncturist is using electrical stimulation or the Chinese herbals, which I have had wow factors from the Chinese herbals. And a lot of people don't even think about that. A lot of their docs don't even go there because they don't know anything about it.
Right. Yeah.
When they Google stuff, all they're seeing is aloe vera caps, pretty much.
Right.
So I recommend people to think about that.
And now if someone's listening to this and it sounds, it seems to fit the bill to them, what would you say, what data should they come to, for instance, like a practitioner like you, practitioner like a physical therapist, or their medical doctor? What data should they come with to kind of best help facilitate that proper diagnosis? So I'm thinking of things like you mentioned, that lady who had the staple, being aware and mentioning that abdominal surgical history, avoiding diary, those sorts of things. What, obviously those 2, is there anything else you would add to that?
Oh, you definitely have to rule out infection. So I like to see my patients at least rule out, make sure it's just not a urinary tract infection.
Okay.
I mean, you definitely have to rule that out. We want to rule out, a lot of things mimic it, including kidney stones, right? That may be an irritant. So, and boy, I can't imagine having a compromised bladder wall and then having to deal with kidney stones or bladder stones. I mean, and that just sounds awful. But I think ruling out infection is the next thing to do there. And then it would be great for them to actually go see like a urologist where they actually do scope the bladder and see if there's anything going on there and run some of those conventional tests we talked about. And I say that with a caveat because I've had patients who've actually gone that route and it has made it worse.
Right.
But it does help us to be sure that that's what's going on. But typically you can make a diagnosis of exclusion without having to do, some of those procedures from a conventional standpoint.
Yeah. Well, it was definitely an education on this. Like you said at the beginning, neither of us are experts, and certainly something new to me. Like I said, I had not treated it.
No, I'm certainly not an expert, but I'm certainly seeing a lot of it. So I'm kind of like, my patients are helping me become an expert on it. I've seen a lot of it over the years. So
yeah, it's going to be interesting to see in the long run if things like this kind of pick up in incidence. If as we drink more soda, as we live less healthy lives, we're more dehydrated, that sort of thing. Do things like this have a bigger prevalence in society? Which only time will tell.
It may be. I mean, I think it speaks to the hydration component. I mean, the older we get, we seem to lose that thirst mechanism, and this doesn't really seem to happen in younger individuals. It's usually, people older than 30 and stuff like that. So I think drinking plenty of water is really good. I mean, it may be a voiding issue too, right? Like I don't know if somebody, I think it's good to train your bladder. Like when you have to pee, you should go pee, instead of a lot of people holding it to the very last minute on a regular basis. Maybe that is causing some of this nervous system dysregulation.
That's a good point. Yeah.
I'm just
Certainly possible.
speaking off the top of my head here. I
Right.
haven't read anything about that, but it's just like, let's think about some of the basic things, especially if you know that we do know there's a hereditary component. If if some of your family members suffer from this, this is not something people want to deal with. I think it is probably one of the most miserable chronic conditions that there are, that there is, so, and it's hard. I mean, these people, it really puts a lot of strain on quality of life, on relationships, on a number of things. So
yeah, absolutely. Anything else, Keoni?
no, I don't think so. I think this is, I just want to reiterate, that PTs can really be helpful here. And I rarely ever see this being referred to PTs. And we heard that from Dr. Sarah Joy Cundiff, right? It's kind of like people have to know about it. And so hopefully this podcast will help people know that there are people like her and Fahim that can really help with this, or at least be part of the treatment for it.
Yeah, exactly. And same with herbalists and naturopathic doctors. Absolutely.
Yep.
All right, everybody. Thank you for listening. We enjoyed
chatting
with you this week, and we look forward to speaking with you next week. Until then, be well.
Take care, everybody.